off the towel and I'll pull out the sheet from underneath.
27-year-old massage therapist Michelle is the one getting the massages these days. She's had her share of hurdles during her first pregnancy.
When people ask how the pregnancy was, I say it's fine, and then I forget I was flat on my back for 5 weeks with the bleeding.
A miscarriage scare at 3 months. Then an accident just a month ago that left her with a broken tailbone that may make a natural delivery impossible.
And then when I fell down the stairs. Pregnant or not, that hurt.
It was a slip of bad luck.
Yeah. Thank God everything was okay.
Yeah. So do you have any apprehensions about your birth coming up?
I'm apprehensive about a cesarean now. I've had women tell me it's great. I've had them tell me it's not.
You just major surgery, but if it's something that needs to be done.
Oh, exactly. If it needs to be done, but I don't want to have that choice.
Right.
Like she asked me last week if I wanted it. I don't think I should be choosing.
Right.
I think nature should take its course, and if I have to have it done, then whatever's best for the baby.
Family arrives at Nicole's mother's home just in time for the birth of a new family member. Seems Nicole is always busy with professional or community work. But right now, she's busy upstairs giving birth. Her and Paul's second child is in a hurry, arriving a week early and very quickly.
Please! Please! Oh! 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 Oh, please, can you see anything? Oh! Oh! Oh, I can't find it.
How are you doing?
Oh, I can't do this for another few hours. I can't.
You can't. Do you need something to drink?
It tastes terrible.
You need some water? Be good if you have something to drink.
I'll get you something.
Hold on. Some tea.
You had a home birth last time, didn't you?
Home birth last time, right?
The plan is for a water birth at home. Billy and Charles discuss the details with their midwife.
So, you should be able to do this visit yourself.
Billy is deaf, and Charles acts as interpreter.
We were talking about the place where we put the tub. He wants it downstairs. I'm a little bit because of the basement. I understand that one of your clients said that it's better near the emergency exit in case of the ambulance having to come in.
If an ambulance has to come in, we're gonna need access no matter where you are. So if you were planning on having your baby in the basement, we would look at the ambulance access. This is a newer home, so it's not likely to be a problem. What you do need to worry about is the weight of the tub. If you have it upstairs, it needs to be in the corner of a room or over a load-bearing wall. What we don't want is the tub to come crashing down into the living room.
I mean, it's no more than your standard tub, maybe a little bit more.
No, and actually, it's just a different shape. It's deeper.
Different shape.
And
deeper.
Shorter and wider. It's a cattle trough. It's a big Rubbermaid cattle trough. Yeah, and they're excellent, and they're light, and they're easy to move around.
Nicole's labor took her by surprise, but her sisters suspected something was up the evening before.
We kind of were in tune with her because we were like watching the signs. Like she's really, really cranky and, for lack of a better word, wenchy.
Yeah.
But and
we could even go one step further, but we won't.
Like we just kept nudging each other, like.
Yeah.
And then she would like.
Last night, she was like over the moon. Last night, like.
She goes, "I like that apple pie." I'm like, "What's wrong with you?" "Oh, nothing. I'm fine." Me and Alexis were like, "Are you okay?" She says, "Oh yeah, I'm fine." Like, well,
we came home and she was in the guest room, like on the floor, like
crawling around.
You know, and I was
on
like,
all fours.
Yeah, and I was like, "Oh, is the baby kicking? You know, let me feel it." She's like, "It's not kicking. It's doing something." So I put my hand on her stomach and it's like, And I was like, well, is it labor pains? She was like, oh no, it's nothing. You know, and then she'd, you know, be quiet for about, you know, she's like, for about 10 minutes. And then they went to bed.
One of my wishes is I want him to deliver the baby.
Mm-hmm.
I just want him to experience it himself.
Mm-hmm.
You have the midwife there, yes, of course, in case anything happens with that. But be there to help him assist it. But I want him to do it himself.
Mm-hmm. There are some technical things that we like to do. After the head is born, whoever your primary midwife is, she's going to want to check to make sure there's no cord around the neck and to make sure that the shoulder isn't caught. Other than doing that technical bit, there's really not much magic to it. And what we do is we step in as needed and step out when we're not. Anybody smoke in the house, Billy Joe?
No one smoke in the house?
You need to stop.
Need to stop.
It would be better if you quit smoking altogether.
Quit smoking. It's hard.
It's very hard. But smoking outside is better.
I got white hair and he stresses me out too. From now until birth, no smoking in the house. No, Febreze doesn't cut it, sweetheart. Outside.
In pregnancy, she looks better than she ever has, and she's like a goddess to me. So I've sculpted, in the tradition of the Greek sculptures, of a Greek goddess, and I wanted to show it as she was pregnant.
Starting a family was an easy adjustment for David. The news hit harder for Michelle.
I was away on business, working, on a ladder, as I usually am, about 15 feet in the air, and I always answer my cell phone. And she told me that she had just gotten the pregnancy test, and it was positive, and that she was going right away to get a second opinion. I dropped everything, got in the car, and just talked to her on the phone until I could be there. I just wanted to be there because she was so scared. And I could hear it in her voice. She was terrified. I knew if I was there, I could calm her down. Michelle's very organized, and we had plans of the 5-year plan, so to speak. And this was a little early for Michelle. She was just getting her career, and the business was just getting started. So it came a little bit as a surprise to both of us, but a little early, I think, was the main concern.
All right, baby's been moving normally. Do you get 10 movements in 2 hours?
10 movements in 2 hours? Oh, yeah.
Okay. Less than 10 movements in 2 hours, we want you to page.
Movement. Into them.
Okay. Okay. All right. Not 10 pounds.
10 pounds, good. He's been teasing me the whole pregnancy. It's going to be a 10-pound turkey. Maybe a 7 or 8.
Yeah. Every time a woman gets pregnant, she wonders why she's done it again.
Yes. Like one of my old friends said, the old saying, we are cursed because Eve ate. But the most beautiful thing about it is we get everything. We get the baby that's smarter than men. Blah, 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 blah. We'll discuss that one later. I'm not going to discuss nothing later.
I'm not getting involved. No.
She's not getting involved in this one.
Nicole, would you like me to just check you at some point to see if you're fully dilated? I think you are, but if you want me to do that, you let me know.
Okay, we're gonna need to bring you up where
it's okay. Is it having a contraction? Coming? Okay. Okay, no. Breathe through it.
Oh.
Nicole. Nicole. Yes.
I don't know what to do anymore. Help me. Help me. Help me.
Bring your leg up, Nicole.
Do something.
Okay, push it. Push it.
Ow! Ah!
Low, Nicole. Low. Focus.
I can't.
Yes, you can. Yes,
Somebody, please don't do that. Please don't put your fingers.
Push down. Push. See the baby coming down, and you're pushing. Envision that, but you're pushing it down. Push that baby down. Don't hold it. Just push downwards. That's it.
So we were really concerned that because a baby is about the size of him, he'd think it was competition and really want to be more aggressive. So we took him for some training. And now we have this vibration collar on him that seems to have calmed him down. Because before, when we didn't have the collar on him, he'd be all over the teddy bear because it's like a toy.
Hey, where's the baby?
Michelle and David have sought advice on how to help the current baby in the family, Finnegan, cope with sibling rivalry.
The key is consistent training. Like, we're going to have to do something with him every day. And I've been reading some books, and I've spoken to a lot of trainers that no matter how tired I am, even if I can just get off 5 minutes a day, just so he knows I haven't detached myself from him, which it'll be hard, but it'll be important for him and for everybody to live happily. Leave it. Leave it. Leave it. Okay. Very treat motivated.
Nicole?
Yes. It's not ready to push, is it?
Yes, you are ready to push. The baby's head is just sitting there.
Are you serious?
Yes.
Please take it out.
That's it.
It hurts.
But you know what? You're doing great in this position.
Yeah.
Okay, now you need to relax. Okay?
Yeah, relax.
So take this leg and bring it on the outside of the stool. Okay? And this one. There we go.
So anchor them on the side.
Okay, all that makes a difference to your pelvic floor. Just relax.
That's right. Focus on the chin into the chest.
I'm so sure something is popping.
Yeah, well,
The membrane's pushing right out.
that's it.
Let's keep the chin down.
Ow!
It's about the sausages. Now. What makes up are good for you. Okay.
Charles is more than Billy's partner and interpreter and a father to Monica and Albert. He's also a doula, trained in the art of providing support for women in labor.
Why did we do doula together? Well, for one, finding an interpreter can be very difficult. Sometimes, or always can be difficult. So Billy had asked if I wanted to try and do this with her, knowing that it's going to be a lot of training. It was a full weekend without the kids around, and just me and how many women were there? 9, 10. There was more like 15 of them, I think, that weekend. And I had gone mainly to be her interpreter the weekend. But it turned out that we had both had such a great time, and we both learned so much that they actually gave me an honorary papers for passing the course and doing a good time. And they suggested that I continue and keep it up, because I think it would be a good thing to have more men in this position. they've only had 3 men so far in something like 5-6 years go through the course, and they were all doctors. I want to be there more for my wife when I can, especially at this time. It's not an easy thing to go through. It's still a hard thing to do.
Lean back into Paul. Oh, he's doing that. He's getting work.
Paul supports Nicole through the final stage.
You're kidding?
Yeah, you did all in one. Yeah. Nick?
Your baby's hand is coming up.
Here comes your baby. Here comes your baby, Nick.
Oh my God.
Look at
Look at all of them.
Congratulations.
excellent job. You did a great job.
Congratulations.
This is all my word.
I'm gonna take the wet one away.
Joe, this is Olu.
It's all over.
Oh, and he's lifting his head. Okay.
Paul, I'm gonna take over for you.
Okay.
Tell us.
Get to work. Get to work.
Hey, what's happening?
Just what you have.
Another
Okay, you got your leg up?
Beautiful baby boy.
C-section or vaginal birth. A decision has finally been made, forced by Michelle's growing health complications.
Since last week, nothing has changed. I haven't dilated or changed in any way. But my tailbone has been acting up just with the increased pressure of the baby. And the head's not quite in the right position. So there is a lot of pain. I feel like I just fell down the stairs again yesterday and re-broke it. So after much debate, and I had a few fainting spells, and I have I have a heart condition that I was born with. So it's been acting kind of funny, making me have low blood pressure, dizziness, heart palpitations, trouble breathing. So after much debate, we decided to have a C-section tomorrow morning. You know, I'm a little bit disappointed, but all along I said it was just a plan. You know, it's not carved in stone. Don't get your hopes up either way, and the goal of the 9 months is to have a healthy baby in the end. You know, I don't feel like I'm any less of a person or anything. I know some women say you haven't really given birth unless it was vaginally, but, you know, if you don't have the choice to do it, then, you know, a baby's a baby. And that's the positive outcome you want.
Welcome to the world. Your mommy's little presents. Your mommy's little presents. Let's go see. Let's go see. What's that?
Yes, Omi? Yeah, just right now. On her birthday. Although she's younger than I am, like, I admire her. If I didn't recognize her strength, beauty, and integrity as a human being, it was evident today. I mean, I've had 2 children myself, but I don't think that I could have been as, you know, she's a warrior.
Look.
Just don't do like last time and go telling everybody how easy it was.
You're great.
I can't believe it's over. That's the only thing I keep thinking of. Is it over?
It is. Very well aware.
It's so beautiful. Oh, I'm so I'm more surprised than anything else.
Why?
I don't know. It's just. Oh, I don't know. Like, is there any time when it's not going to be such a big surprise anymore? And I'm just thinking.
It's the miracle of life, I mean, you know?
Thinking this is just so not what I had planned for my day.
Next time on Birth Stories.
My mom just had a really bad experience with her epidural with me.
Oh, really?
So I have some anxiety about that.
What happened?
It froze her lungs and her heart.
So it went up a little bit too hot?
Yeah, and she felt the cutting. And they were trying to get me out ASAP, and they cut my face.
And your doctor said it's okay to go again, you think?
He said I can do it as many times as I want.
Oh, really? Excellent. Tay, how many brothers and sisters you want? How many brothers and sisters do you want? Huh? She's like, well, I kind of like being the single kid right now. I get everything. Yeah.